My name is Bizri. I am an academician and a pharmacist from Beirut, Lebanon. I am also the HAMIS FIP Executive Committee member for Africa and Middle East. Today's session will provide some insights on pharmacists supporting patients to self-manage common ailments. My pharmacy is in the heart of Beirut, near the American University of Beirut. As a result, my clientele is a mix of young, middle-aged, and geriatric people. In my pharmacy, I see a lot of patients in pain: back pain, toothache, headache, or migraine. The most complaints from the geriatric population are musculoskeletal or lower back pain. They suffer also from gastrointestinal complaints. Lots of young people also will have some common complaining from reflux or heartburn due to their quality of food and lifestyle. Young generation individuals of both genders and peri- and postmenopausal women seek advice about sexual and reproductive health. I rarely see children, but sure, sore throat is very common in all ages, and it is very critical to educate patients in this area to avoid overuse or misuse of antibiotics and address vaccine hesitancy or refuse. Community pharmacists are well positioned to help and support patients in understanding their symptoms and how to handle these minor ailments. The most crucial role pharmacists can play is not only educating healthy people and patients about their complaints, but also training them about their complaints, about their complaints and making good decisions about their condition. When these people are empowered, they will be able to decide and choose the best solution that fits their condition. At this moment, we can say that pharmacists have achieved their role in promoting self-care interventions in the right way. A good example is when young women come to ask about the best method they should adopt for contraception. My role and duty are to educate these young ladies about different methods of contraception, their side effects, ease of use, and interaction. And they decide to adopt the best solutions that fits their case. Trust is the foundation of the patient-pharmacist relationship. In addition, pharmacist competency and knowledge will encourage patients to seek advice and to consider the pharmacist a reliable source concerning their health and well-being. The right to autonomy and privacy of people and patients is very crucial. One of the initial steps in facilitating the self-care interventions process is the presence of a private consultation room. If this private room is unavailable, the pharmacist has to take the patients to a distant corner of the pharmacy and conduct the conversation in a low voice. The pharmacist must assure the person seeking assistance and advice that it is his or her duty to highly respect the information delivered by the individuals, as well as his or her privacy. Access to these services is done without discrimination or prejudgment. Confidential care, especially for vulnerable populations, such as women or adolescents, encourage people to seek help in pharmacies and consider them as point of care and education to manage their minor ailments. In Lebanon, ovulation and pregnancy tests are widely available in pharmacies. Unfortunately, the stigma surrounding AIDS has made the availability of HIV tests inclusive in private and hospital laboratories. Unlike in many other countries, point-of-care testing for pharyngitis is not unfortunately available in Lebanon. But educating patients about how to differentiate between viral and bacterial pharyngitis is possible. Rapid COVID-19 test is also available, and patients can do the test in the pharmacies or learn how to use it at home. Lifestyle changes, OTC medications, and referral when necessary, and after triage are the tools required for appropriate diagnosis in case of gastrointestinal complaints or musculoskeletal symptoms. Thank you.